Yeah, so this was a combined study done between Australian and US sites, in which we had over 400 patients with metastatic castration-resistant prostate cancer, and we collected circulating tumor DNA, ctDNA, which is the DNA floating freely in the plasma of patients with cancer, and we've developed tools now for taking those very small amounts of DNA and being able to profile them and pick up mutations and amplifications in genes, and really, in prostate cancer, I think it's quite clear that that's that's as accurate a way of assessing the genomic profile of prostate cancers as a tumor biopsy is. So this is, but obviously it's much easier to collect. So we did this study with over 400 patients, and we have a large panel of genes that we can look at using ctDNA. And in this particular analysis, we focused on DNA repair genes, and in particular, we looked at the BRCA genes that we've been talking about already. And what we saw is that so we know from clinical studies that BRCA mutations can predict efficacy of PARP inhibitors, but and BRCA mutations are present in about 10% of patients with metastatic castration-resistant prostate cancer, and other DNA repair gene mutations are present in about another 20 to 25%. So about 30% of patients have mutations in the homologous recombination repair pathway and other DNA repair pathways in prostate cancer. So it's a very common biomarker to find. And so, of course, while it predicts efficacy, or at least the BRCA mutations do, particularly of PARP inhibitors, the question also then comes to mind, well, what does it mean in terms of prognosis? Because patients are getting many different treatments with prostate cancer. What does it mean in the context of those treatments if you have a BRCA or other mutation? And what does it also mean just in terms of your overall prognosis, independent of treatment? So using this, large multinational, series, we looked at the ctDNA of more than 400 patients and looked at the impact of BRCA mutations on response to non-PARP inhibitor treatment, so the sort of taxane chemotherapy drugs and the androgen receptor pathway inhibitors that we've spoken about, as well as overall prognosis. And what we showed is that patients who had any DNA repair gene mutation, but particularly BRCA, had a very poor prognosis, unfortunately. They didn't respond as well to standard didn't respond as well to standard drugs, particularly the androgen receptor pathway inhibitors, the hormonal drugs that are the sort of backbone of our treatment for metastatic castration-resistant prostate cancer. And they had an overall worse prognosis. And so I think that what that really shows is that we need to, identify these mutations so that we, can predict outcomes in these patients, so that we can intensify, treatments where possible, use PARP inhibitors in these patients, come up with and try and identify other novel strategies for how we can target these patients. And we did actually show that there were, upregulation of some other key targetable genes in these patients with BRCA mutations that might help us inform clinical trials in the future. So the study really helped us confirm, unfortunately, what, that BRCA mutations in particular are associated with worse overall prognosis, less benefit from current standard of care treatments other than PARP inhibitors, and in particular androgen receptor pathway inhibitors. But it also provides some hope, because we did see upregulation of some key actionable mutations and genes in patients with BRCA mutations that we hope might be, provide an impetus for future clinical trials where, with rational targeting approaches to improve outcomes for patients with BRCA mutations in prostate cancer.